So I'm here today talking to Joel Sherlock from Vitalis, who has been a pioneer in the industry and has learned so many lessons from the different markets across North America. Joel, share with us some of the learnings you've had.
Things have evolved very, very quickly in the cannabis markets, both, the lessons we've learned in the recreational markets of California, in the federally legal markets, starting with medical in Canada and now into, what lots of people are calling cannabis 2.0 of products. But I would say probably the biggest lesson we've learned is the only guarantee is change. Change in the products that the patients are looking for, change in the innovation and the research that's being done is really driving new products and new parts of this plant are being discovered and benefits from, be it THC and CBD, which a lot of people are talking about now, but the broad spectrum oils or CBN or CBG or THCA. And we're only scratching the surface of what's possible. But when we look at it from a manufacturing and equipment standpoint, like how to build these labs and how to take grown cannabis and then, take it from the agricultural product and then take it down into, a pharmaceutical level product. It takes a lot of equipment, it takes a lot of innovation. Ultimately you can only extract what's been grown, but getting it down into those consistent products that the EU market is going to be looking for, and then making sure that the foundation of your facility is ready for the inevitable change. In the US markets, it was much like when coffee came to the market. Good coffee was strong coffee. How strong is your coffee? And that's what everybody was looking for. And we've seen a similar side here where isolated products. When you look into medical markets with isolated products, you do find yourself, if you look at the Billy Caldwell story, he had Dravet syndrome. They brought him to the US and he was getting treatment with a broad spectrum. And then when he brought the medicine home, it was seized at the border, and then Home Office, it sort of facilitated the UK market. But when they got Billy onto an isolated product, it was working, but not as well as the broad spectrum. So as the research advances, that's very exciting for all of us. But right now, Billy's mom can tell you that this product unequivocally works better than that product for her son.
Right, and I think that's one of the things that I've learned from being in Israel and understanding that there's so many cannabinoids, and we do just talk about THC and CBD all the time. When you take the plant and you're actually going through that process of extracting it and bringing it to the product that is actually medically useful, right? Because smoking cannabis is not what medical patients want, and that's not where the market's going. Like, how does that work with an extraction facility where you can actually isolate and actually go from broad spectrum?
So in reality, it's all about, what the input coming in is it trim, is it flower, what's the potency of it, and then what are you looking to take out, or what's the final product you're looking for, and then that's going to determine the best extraction methodology or what to use in that situation. There are some advantages. Ethanol is a very good solvent. It can get through a lot of material quickly. CO2 is a very selectable solvent, so different pressures and temperatures will isolate different parts of the plant. Ultimately, it's what are you putting in and what are you looking to get out, and then we can refine the process in the middle.
That's interesting that you say CO2, because there has been a lot of talk around oils and vape pens and all the conspiracy theories and or problems that they're finding with health factors and tobacco and vape pens. What are your thoughts around CO2 and that whole process and vaping?
When you look at the vape crisis, it always just boils down to testing, regulation and testing, right? It's you buy biomass, you test it, then you extract it, then you test it again, then you formulate it, and then you test it again so that you know exactly what's in it. When you look at the medical market over here, it's our assumption, and I think CO2 and ethanol are going to be the leaders. I don't think we'll see hydrocarbons over here, which would be like butane, propane. Those are more driven towards recreational products, only because, if the extraction is done properly, you can get those residual solvents out, but any residual solvents of a known hydrocarbon in a medicine is just not a good combination.
We're in Malta, and this is obviously, there's a lot of progress. They're being a very aggressive country and being a gateway for the EU. What are your thoughts about the market in Malta and why you would want to be operating?
The regulators in Malta have been very proactive in getting a structure that is regulated, properly organized, but also pro-business, right? It's very difficult for companies to come into a market and invest millions of dollars when the regulations aren't yet finished, or when it's a trial program that should get renewed. All of those things are risks. So that the regulators here, Malta Enterprises, the Medicines Authority, they've been very proactive in getting things set up in a way that's safe and conducive to business.
This is year 2 day 2
Yep.
of the conference. Can you share with us your experience and what you love about Medcann World Forum and what you think sets it apart?
I love that it's it's a curated group of, both in content and attendees. The conversations have been phenomenal. I'm looking forward to another day of them. And, a lot of great speakers, a lot of great topics, and just a lot of driving that thought leadership and innovation is really what brings us back every year.
Amazing. Well, thank you, Joel.
Thank you.